Hello, my friends. Welcome to my channel, Life with Everyday Haley. I'm really excited to be back with you all today. As you all have found out from my channel, finding my channel, I am on a journey of fertility treatment. And I'm here today to give you an update on my journey, the journey my husband and I are on. And it has been over a month since our loss, and I am every week feeling stronger and feeling better. The grief is real. The grief never goes away, and it is a constant battle. The more time goes on, the more I feel like I can't believe this is my life. I can't believe this happened to me. It almost feels like a really bad dream. And sometimes it just doesn't feel even real, but it is the life that I'm living. So what I'm trying to do is focus on being the best person I can be right now, get the best medical care that I can, focus on my spiritual walk with God and my relationship with Him, making sure that we are connecting, that I am listening to Him, that I am pouring out my heart to Him, and also making sure that my relationship with my husband is still good, and that we're pouring into each other. I am so thankful that I have a wonderful husband that's so supportive, so encouraging, and so faith-based that I know that we can get through any battle. I am 100% convinced after going through this with him that we can get through any battle times. I also really appreciate my friends and family who have been very supportive, offering prayers for me consistently, and those in my life that have even given me medical advice and guidance on how to move forward. When you go through something like this, it feels very isolating, but there's people around you that have been through it. That is one reason why I have my YouTube channel, and I have found out a lot of information from this beautiful YouTube community that we're in as well. So I'm happy that you're here, and I'm happy to give you an update today. So this is an update from my first visit with a fertility specialist. So I met with a fertility specialist. It is not a specialist at one of the external private clinics that I talked to you about. I talked to a friend and was referred to this physician that focuses on infertility PCOS. They are an REI type physician. And so I went this route first. I'm still waiting for my private consultation. I did both of these because why not? Why not take advantage of the resources around you and get opinions from professionals? You can get a second opinion if you want to. You can take advantage of the resources that we have in our amazing medical community. So I met with a fertility specialist, and that appointment was absolutely amazing. I left that appointment feeling hope and feeling heard as a patient and feeling validated in my physical concerns, my current situation, and where I've been. And I left with a really good feeling about that provider. I found that seeing a fertility specialist was a higher level of care than what I was receiving in the OB world. And that was where I wanted to go, considering I've been dealing with recurrent pregnancy loss, if that makes sense. I knew that I needed a higher level of care and support and diagnosis, and someone that could maybe walk me through my next pregnancy. Because as we know, I get pregnant very quickly, but I miscarry, which really scares me, honestly. It terrifies me to move forward. I'm still kind of terrified. So this video will not be focused as much on emotions. I'll do another one more focused on like emotional status. This is more of an update on how that appointment went and where I'm going next. So that appointment went great. She spent almost an hour with me, one-on-one, and we just talked. We talked about my medical history. We talked all about my losses. We talked about my PCOS potential diagnosis. We talked all things me and how we move forward. She let me see my ultrasounds from my loss, which was so incredibly beautiful. I have never seen the ultrasound when I went in, and I was told that my baby did not have a heartbeat, did not continue to grow. I wasn't allowed to see the ultrasound. If I had been asked if I wanted to see that, the answer would have been yes. First, she said, let's take a look at your ultrasounds, because I had shared with her that my latest ultrasound showed a PCOS on my ovaries. I just spoke up and said, are we gonna see like my baby, my ultrasound? And she was like, do you want to see it? And I said yes, because I wasn't given the opportunity to see it previously. She pulled it up And I immediately started crying. I saw my baby, everything about it. It was such a good picture. He asked if I wanted to take a picture, and I pulled out my phone and was like, absolutely. And in that moment, she was so compassionate with me. I was shook that this provider let me do that. I was like, thank you from the bottom of my heart, because like I never got to see that. And that is so beautiful. And I've looked at it so many times. I sent it to my husband. I'm gonna print it off, put it in a photo frame, and we're never gonna forget that baby. That was so special that she let me do that. You know, that was my first pregnancy that progressed far enough to get to an ultrasound. Something just stopped. So I've had to process that in my heart, like what went wrong. I just don't know. I just don't know. And I'll never know, but God knows. And God has that baby in his arms. So I'll move on from that. We also looked at my ovaries, and we saw the follicles on my ovaries consistent with PCOS, both of my ovaries. This is PCOS, like, here you go. And I explained to her how I had a hard time with my diagnosis of that. So our next steps moving forward are first she told me to limit caffeine in the TTC phase and the pregnancy phase, no caffeine. She talked with me about no ibuprofen in TTC or pregnancy, which that was new as well. I had always heard pregnancy, obviously, but not TTC. Another thing she mentioned was supplements. So I'm going to share with you a few supplements that I have implemented into my routine. The first one is I changed my prenatal. This was from some research I've done. She did not recommend that I do this. This is from she just wanted me to be on a prenatal, but this is from some research that I have done through Facebook groups and learning about pregnancy loss. I chose the Smarty Pants prenatal. This is from Amazon. The reason I chose this, inside of it, it has all the vitamins, A, C, D, E, K, all of that. It has vitamin B, it has folate, methylfolate. So not folic acid, but methylfolate, the natural version of folic acid. It's supposed to be better for some women that have recurrent pregnancy loss. It has fish oil omega-3 in it, and it has DHA and EPA and inositol. So all of the ingredients that I wanted in a prenatal was in this one. My other prenatal was missing a lot of these. A great prenatal, it didn't make me sick at all. Some of them do kind of make me a little sick, or have a fishy smell that just makes it hard to swallow. Like I think I had tried like a more natural brand, and I was like, I can't do this. This is 4 gummies a day, and they taste really good. They just taste like fruit snacks. So you can just have a little snack. I haven't had any problem with it. Side note on this one, there is a male version of this that is the men's multivitamin. She wants him to be on one as well, which I already knew that. He is on one. But this one, there's a men's version, and it has all of the same ingredients as this one. So we're about to switch him to the men's version of this one. We feel like it's better for our current path. Next, I'm taking, this is the Intimate Rose Myo and D-Chiro-Inositol. What is this? This is to support like ovarian health. It has the proper dosage that they want in inositol. For people like me that I've been researching, I take 4 of these a day, so 2 in the morning and 2 at night is what I try to do. They're just like vegetable capsules. These are also from Amazon. This has D3 in it, vitamin D3, myo-inositol, ashwagandha root, and D-Chiro-Inositol. So a really, really good supplement for women with PCOS. There's a lot of videos on TikTok about this one. So, and related type medicine. So go look at that. This can be very helpful apparently with hormone cycle regulation. The next one is CoQ10. If you're familiar with CoQ10, it helps like cellular development. And in this one, it's just got CoQ10 in it basically, and some omegas in it as well. I take 600 milligrams of this a day. This is one of the most popular supplements you can research about improving egg quality and just overall helping women that are having miscarriage. So CoQ10 is really vital, and I take 2 of these a day, so 1 in the morning, 1 at night. I'm also on metformin. The dose for patients with PCOS is supposed to be 1,500 a day, so that's 3. of the 500 milligrams. I'm currently trying to work myself from 1 to 2. Last supplement is NAC. I actually just ordered this one, so I haven't started taking this one yet. This is 600 milligrams of NAC. This is supposed to be really good for cellular health and egg quality as well. Most of these, my goal is to take for this period of like wanting to be pregnant, but not yet. So all of these came from Amazon for me. Again, I did spend about $80 on these supplements right here. And honestly, this is a month supply. So I just want to say that this is not cheap. But I'm willing to try supplements for a few months to see if it works. If it doesn't work, then obviously at least I tried to help my body naturally produce better egg quality and hopefully have a good pregnancy. And sometimes you have to invest in what you want for your future. So I'm seeing these supplements as an investment. Yes, it's pricey. However, it's something I need to do right now. I wanted to also share with y'all 2 things that I had shared previously on my channel. It starts with the egg book. This is a great book to read about supplements. That's kind of where I learned about these supplements and how you can prepare your body better to be ready for a pregnancy. This is the cookbook that comes with it. It starts with an egg fertility cookbook with a Mediterranean diet recipes that are low for inflammation and good for PCOS and healthy. There's some really good recipes in here. So I'm going to dive in and start cooking some really good recipes from this book. Okay, so let's briefly talk about next steps for my fertility treatment. So when I went to see her, I was still waiting for my cycle to come back and just really just waiting for my body to regulate. Well, my cycle came back this week, but it's still spotting. Like it's been spotting for a couple of days. I knew my cycle was coming back for the first time because I started having cramping out of nowhere. So I knew I was having PMS cramping. That started on a Sunday. I started spotting on a Tuesday. Cramping was bad, but not outrageously bad. And low-dose Tylenol was helping, so I just took that. She told me that when my cycle comes back, she wants to do additional blood work and hormone testing on me. Okay, so she told me to message her on day 1 of my cycle so that we could start getting me scheduled for these tests because it's all time sensitive. For ultrasounds to look at my follicle count on my ovaries, as well as blood work for like FSH, different types of hormones like that. So more to come on that when those results come back. And then she wants to do some additional labs that were more in detail than my OB. She said it's great that I had an HSG procedure previously. That was good. That would have been another thing she suggested. You can view my channel for how my HSG procedure went. She does want to do a uterine biopsy on me at in the middle of your cycle, all of the tissue to test for endometritis or other things. She also suggested a sonohysterogram, which is the saline version of the HSG, done around the same time as the biopsy. I don't know if they can do it together, but that would be ideal. And she did give me a lot of paperwork, so I felt comfortable coming out of my meeting, like knowing how to move forward. Another thing she suggested was the sperm analysis. We are going to do that because that actually is not a very expensive test and could potentially tell us information about his side of things. You know, I'm always looking at myself, but sometimes there's a male factor to things as well. She also encouraged us, which we've already done, to go through with genetics testing, which we have done the preconception carrier screening. It came back great. We don't have any matches for that, but we are now doing the karyotype chromosome testing, typically done after 2 or 3 losses to rule out chromosome issues being passed down to babies, which could create bad embryos and just lead to recurrent miscarriages. That's something we definitely want to rule out. I personally felt very passionate about going ahead and doing this. So we started with me. We will see what the results say. And then we will go, if mine are good, we will test him. If mine are bad, then we know we need to move forward with additional fertility treatments. So we are pending those results for me. That comes back in about 3 weeks. The doctor did encourage us not to try again until we get through with our testing. I completely agree. The whole purpose of testing is to figure out what's going on. And we don't want to repeat another loss and go through all of that again if we can avoid that. Emotionally and physically, I don't feel ready to try again. I'm still healing. Like, my body's obviously bouncing back. My heart is not bouncing back yet. So anyways, it just takes time. I would encourage you not to rush through anything. If you're going through testing, just let it play out. The more you know, the more you know. The more knowledge you have, the better you'll be to prepare for your future and moving forward. A treatment plan she did give me, as obviously I've got something going on with PCOS. She shared with me that we could try letrozole, which is a very common drug that helps with ovulation in women like me and PCOS that don't ovulate. I think the idea is it increases like a better ovulation of more mature follicles that can turn into eggs that might, be a better route for producing a better egg and better fertilization and just better pregnancy viability. I know people that this has been successful for them, people that are very similar to me. I've done a lot of research online after she brought that up, and it looks really promising, potentially for someone like me. I told her I was definitely willing to try that. She did say we could try like naturally again. But honestly, I'm ready to try something new. I'm ready to try something more helpful for me. We talked about doing progesterone supplementing after I ovulate, which is very commonly needed in women with PCOS and people that are having recurrent loss. Sometimes supplementing with progesterone can be very helpful, actually. You can find a lot of research online about this and how there's women that helps them have a successful pregnancy. So again, it's really hard to find the root cause of things when you're in this place, and sometimes you just don't. But I'm really thankful that like some of my testing is giving us answers. It's really hard to be in this place and all your testing is coming back normal. I don't know what you would do and how you would feel. Most of my testing looks great, but there's a few things here that I think are worth diving into regarding the PCOS side of things. Also, another reason I'm feeling hopeful is it was so hard to it's hard in general to be a woman that is struggling with recurrent pregnancy loss, or just shows up for her ultrasound and the baby is deceased. Like, I went 8.5 weeks of my pregnancy thinking that everything was fine, felt totally great, and got there and the baby was already deceased. And so just that period of waiting in that gap, that is so hard. I honestly, personally cannot believe that women are not seen until that week of their pregnancy. I understand that sometimes things are not visible or easy to understand when you're earlier, but they saw my baby on my ultrasound at 6 weeks. So I know that they could, it's my opinion that women should be seen earlier in their pregnancies. It's a really hard time, especially if you've had losses, to wait that 8 weeks. So I will not be doing that again. That is why I am seeing a fertility specialist that can monitor me early, walk me through those first few weeks, check on me. I will feel supported at least. I won't be totally surprised when I show up, and hopefully, I can avoid what I just had to deal with. I just know, okay, since I'm having struggles getting through my first trimester, can we just monitor me through my first trimester? And I think that's an extra level of support that you can get at a fertility clinic. So anyways, that is the update I wanted to share with you all today. I have great moments of feeling very confident and positive and hopeful. And then I have bad moments of feeling a lot of grief and just confusion and overwhelming feelings. Again, I'll share statistics I read online. 60 to 80% of women that have recurrent pregnancy loss will someday have a successful pregnancy. I think that is very telling. God is telling me not to give up, even though it hurts. Don't give up. Keep pushing. Keep fighting for your health, advocating for yourself. Your tests, all this hard work you've been doing, all this blood work will pay off, and you will learn more information as you go. So thank you for tuning into my channel. Thank you for watching this update as I move forward. Again, I do have my additional fertility consultation next week, so I'll get to hear is his opinion the same? Does he have a different treatment he would approach? Follow along for more. I will try to keep you updated on my journey, whether it's good, bad, happy, or sad. This is meant to be a support for you. I believe that through anything bad we go through, it is our choice what we make of it. And I am choosing to try to help in my journey. So thank you for watching. Would love for you to subscribe and follow along for my journey. I hope this video has been informative and helpful for you. If you have any questions, just put them below in our comments so we can chat, and I appreciate you listening to my video. Thanks so much. I'll see y'all soon, and y'all have a good day.